Watching Health with Diane Atwood. And Diane was with us a couple of weeks ago. We were talking about colorectal cancer and the importance of getting colonoscopies for prevention. And you got quite a response to that. And you have a follow-up for us today?
I have a couple of follow-ups.
Okay.
Watching from his hospital bed at Maine Medical Center was John Nappy. Saw us talking about it. He's 64 years old, never had a colonoscopy in his life. Well, it turns out he has stage 4 colon cancer spread to his lungs. So when he saw us talking about it, he immediately asked a friend to get in touch with me. He wanted to get his message out, just say yes. He always said no to a colonoscopy. Don't have time, don't want it. So he wants us to just say yes.
And from what you've heard, his story and reaching out like that really did inspire some people to make the move, right?
It did. I wrote about him on the blog.
Yep.
And there was one gentleman in particular who said he saw him, he read the post, he immediately called his doctor and made the appointment. So yes, I've heard all those stories. And I would like to just wish John well because he's starting a course of chemotherapy.
All right, we'll keep him in our thoughts. We also spent a lot of time last week talking about how to pay for colonoscopies and the fact that they're supposed to be taken care of under the Affordable Care Act, right?
Well, there's this fine print.
Right.
So I said yes, that the Affordable Care Act requires that all private health insurance plans cover colorectal cancer screening tests as a preventive service. So with no out-of-pocket costs to patients. Well, that's true, but I heard from Debbie, who happens to have ulcerative colitis, and she has to have a colonoscopy every 2 years because she's at high risk of having colon cancer. She turns 50, she thinks, oh, it's going to be considered preventive. It wasn't. She ended up having to pay $1,500 deductible plus. So
that's because she had already been diagnosed with a condition that required this test.
Right.
Okay.
I checked with an insurance, a fellow blogger, Linda Riddle, who writes the blog Health on Insurance. She says under the Affordable Care Act, health insurance has to cover preventive tests. That includes a colonoscopy for people 50 to 75, no copays. But a test is preventive only if the patient has no symptoms of a disease. It's diagnostic if you have symptoms or at high risk.
Okay, an important distinction because you know, a lot of people will fall into one category.
And you can appeal process, but you can read about that on the blog as well.
Okay, fair enough. Now let's move forward. What do you have? What are you looking forward to on the blog?
Well, real spring. I'm going to have a Mediterranean adventure on the blog. I am going to start following the Mediterranean diet, which isn't really a diet. It's just a way of eating. I'm going to blog about it. I'm going to share the recipes, things that I learn. I'm going to be getting expert help from the Maine Academy of Nutrition and Dietetics. That's what all the registered dietitians belong to. So we've got some basic tenets. Every day we should be using olive oil. Eating our vegetables, as we know, eat soy, beans, peas, Greek yogurt, whole grains, not just bread, fruit. That's every single day. Several times a week we should have seafood, nuts, and dried fruit as our snacks, cheese. You'll like this one, I think, red wine.
Sounds good, at least once a day, right?
Rarely eat meat.
Okay.
Or sweets. But anyways, you can read about that on the blog. You can follow me, get recipes. I think it's going to be a lot of fun.
Considered one of the healthiest ways of eating, right?
Yes, research proven one of the healthiest ways of eating.
Very good.
And before I go, I would just love to say thank you to all the people who've contacted me and who have wished me well and welcomed me back.
Yeah, we're really happy to have you back, Diane.
Oh, I'm happy to be here.
And we'll see you again in a couple of weeks, right?
I'll be back.
All right, very good. We're going to take a quick break and be right back with a recap of this morning's top stories.